Hello, this is Karen Yaboa Norman from Pros for MPs. Today on highlighting the MP part 2, I have psychiatric nurse practitioner Aasta Knox. For those of you who remember, I did an interview with Asta in October of 2023, and she just discussed on how she started her private practice, Peace Psychiatry Services. So today we're just going to get an update on how her practice is going. Welcome, Star. Or Asta. Thank you for joining us today.
Thank you for having me, Karen. I
Welcome.
appreciate it. I appreciate that.
So can you just tell our viewers when you opened your practice, the name of your practice and the services you offer?
All right. So the name of my practice is Peace Psychiatric Services, and I officially formed the business January of 2023. So she's been open for a couple of years now. And I provide outpatient psychiatric services for patients age 6 to 120. And it's done over a in-person as well as a virtual format.
Awesome. And how is your practice going? Tell me how Peace is going.
Peace is going pretty good. We've entered, of course, the new spring season, and it just seems like in the spring season, typically you get an influx of patients. Beginning of the year, they have new insurance, so I've been getting quite a bit of referrals in this new spring season.
Oh, that's awesome. So it sounds like the referrals are growing and keeping you busy.
Yes, and I think because I've been in practice now for almost 2 years, and I think that the Peace's name is kind of getting out there, and so I'm starting to see an influx of referrals from very different sources, which is a little bit different than it was when I first started the practice.
Great. Word of mouth is everything. How many patients do you see a week on average?
I can see anywhere between 40 to 60 patients in a week.
Oh, that's a good amount. Wow. Okay. And then how many patients come to your office a week?
So I just recently started offering in-person appointments in November of last year, and
Mhm.
so I am starting to make a lot of request the patients that I've been seeing for a couple of years now to start coming in person. So it depends on where their cadence of their follow-ups, and those patients typically are my pediatric clients, particularly those that are taking a stimulant, so that I can do a physical assessment on them if need be, height, weight, that kind of thing. So I'm starting to make those patients come in. And then I have patients that only want to do in-person appointments, and those are pretty much my geriatric population. They don't know how to really navigate the bells and whistles of Zoom and whatever Doxime, whatever that we're using, those platforms that we use, so they prefer in-person appointments.
Interesting.
Mhm.
Yeah, it's definitely easier sometimes in person if you have difficulties with technology. What
Absolutely.
is the youngest age you see for pediatrics?
I see clients as young as 6 years of age. I have one single client that's 6.
Oh, nice.
Mhm.
Awesome. And how are patients finding you?
So as time has gone on, the referral base has sort of changed a little bit. Patients are able to find me if they, look in their insurance company website for, providers that are attached to their insurance company. So I get patients like that. I get patients by word of mouth, like a patient of mine decides to refer their friend or their cousin. So I get
Mhm.
patients like that. I get patients, a huge amount of my patients that get referred to me are from the therapists that I've formed relationships with. And those therapists are pretty much far reaching. And so I'm starting to get an influx of referrals from them as well. Um, and then, like, for instance, my office is in a building that also has a therapy practice. We're on the same floor.
Mm.
And so we met each other. I went down the hall, hey, how you doing? Met each other. And so now I've noticed that as time has gone on, we're starting to refer back and forth to each other. So many various ways, doctors' offices. Um, and I'm also on Headway, Alma, Growth Therapy, and Spring Health. So I get those patients as well. And sometimes those patients come off of those platforms and they decide to come into Peace as a private patient. So, mhm. So many ways, many ways.
Yeah, so as an entrepreneur, you want to network to a variety of schools, colleges, doctors' offices, hospitals, social workers, employee assistance programs, all that.
Absolutely.
Mm.
Yep.
And what EMR do you use?
I use an EMR called OptiMantra. When I first opened Peace, I kind of looked around at some of the other platforms, and they were just a little bit too pricey for me. So I liked OptiMantra because it was kind of, it was very user friendly. It had all the pieces that I needed to start the practice, and the price point was very, very attractive. Because at that point, I didn't want to spend a whole lot of money. So for what they were offering for the price point and the discounts that they offered, that's what made me choose OptiMantra.
Mantra. And what are the pros and cons of using OptiMantra?
Well, the pros are still the price and then
Mhm.
the integrated services. So, for instance, of course, you have this nice platform that you can document on, and documentation is pretty user friendly. It's easy, and it fits what I need to document on my psychiatric patients. It also has some integrated services where you could, chat with your patients through a portal. You can send them messages if you like to kind of keep some of that privacy. You can fax directly from the platform, or you can use an external fax that comes with your package. Um, Adding providers on is a lot cheaper than with other platforms, I've noticed. And then it's just so easy to use. It's just so user friendly, very easy. And then the supportive services that they offer from their help desk is nice as well too. So those are the pros. The cons, some of the things and OptiMantra has added some new features. As
Mhm.
time goes on, they continue to add features. But one of the things that I don't care for is they don't allow you to lock an individual chart so that to keep it private. So, for instance, my virtual assistant has a friend that is my patient. And
Mm.
obviously, I don't want her to see that information on that patient. So I'm not able to lock out that chart so that to keep privacy for that particular patient. And a lot of EMRs allow you to do that, but unfortunately, OptiMantra doesn't do that. So that's one of the cons. Another con that I noticed, but they've since fixed it, is time zones. So like I have patients that are in different various time zones. I have see patients that are in Indianapolis, which is 3 hours from me, New York, which is I think is an hour ahead of me. And so there was no way to adjust the time zone for those particular patients so that when they get email reminders about their appointments or text message reminders about their appointments, they all come out in Central Standard Time, which is inappropriate. You have patients showing up
Mm.
at the wrong time. So they finally did fix that. That was a con. Now it's a pro. But yeah, those are the pros
Yeah,
and
I
cons.
could see that being confusing to
Yes, very
patients.
confusing. Very, very confusing.
Mhm. But I have used OptiMantra. It is user friendly and it's affordable. So if you're looking for an EMR, you could do OptiMantra. And I think it also offers a free trial for a month. So
Mhm.
for anyone who's looking for an EMR, check that out. What made you want to get a physical location and providing mental health treatment?
I wanted to get a physical location because I guess it started with me getting referrals for patients who needed controlled substances. And with the DEA changing its recommendations and then changing them again, I felt like let me just stay ahead of things and go ahead and look for a physical location so I can start seeing those patients in person. As the COVID-19 pandemic was drawing to an end, and people were starting to kind of open up their offices so people could come in, I figured let me just go ahead and get started and be ahead of the game in that regard. So I started looking for a physical location.
And what was the process like finding an office?
It was a little challenging because again, price point, you know,
Mhm.
there's some offices out there that are pretty pricey and then probably a lot more than what I needed. And I also needed an office space that could facilitate the care that I wanted to give. So, I had these therapist friends that, they had their own office space and they invited me over to look at what their building had to offer. And it just wasn't appropriate. I needed something with a therapist feel to it, but also something that had a clinical feel to it as well. So my office is nice. It's not too big. It's not too small either. And it used to be rented by a physician, a private practice physician. So it's set up in such a way that it looks like a small clinic, but it also has cozy rooms that can give you that behavioral health kind of feel to it. There's no exam tables, there's none of that
Okay.
stuff in there, but it's a nice, comfy place. There's a waiting area and there's a receptionist area, which is really nice where you can check patients in. And then there's two separate offices to see patients in. So it just kind of met with the needs that I had and that I needed.
Oh, that's great. And then you also said you mentioned earlier that you also liked getting your own physical office to like check blood pressures
Oh,
on
absolutely.
patients.
Yeah, absolutely. I did make that point. And so I've noticed, over the years while we were, seeing patients virtually, you know, you're prescribing medications for them. It doesn't necessarily have to be a stimulant, but you're prescribing medications that could have an impact on their heart rates, blood pressures, that sort of stuff. And so we are trusting the patient to either take their own blood pressures and chase
Mhm.
after them to do that, or to get their blood pressures checked at their primary care physician's office and have them provide documentation of those vital signs, not just necessarily taking the patient's word, but have them provide that for you. And sometimes it can be a bit of a nightmare. You show up, the patient shows up, okay, where's your vital signs at from your primary care physician's office? And I didn't get them done, or my primary care physician canceled my appointment. They decided to go to Venezuela. So that got to be a little arduous. So it's kind of nice to be able to actually check my own blood pressures. And I have been finding some of the patients that I've been seeing for a minute, their blood pressures are elevated, heart rates are elevated. They have edema. I've seen, they have a edema. So it's kind of nice to be able to, set eyes on those patients and make sure that I'm prescribing appropriately for them, or getting them off to see their primary care physicians because their blood pressures are high. And I
Yeah,
can't
that
how many times I've done that. How many times I've done that. Hmm.
yeah, that extra care is definitely needed for
Yeah.
patients because yeah, I've had patients who I've put on like Effexor or Wellbutrin, their
Yeah.
blood pressure went up, I had to discontinue the medication. And then some patients whose blood pressures have gone up with stimulants and they needed to be referred to primary care provider. But having your own practice gives you that inability to actually, do the work for the patient, like get the blood pressure instead of relying them to go
Hmm.
to a primary care doctor or them doing it inaccurately at home.
Right.
So that's good to know. That's
I had another patient too, that I was doing a intake evaluation on, and he was minimizing his symptoms and minimizing the things that he'd experienced in the past, dealing with various psychiatric providers. And I was checking his blood pressure, and I went to help him take his jacket off, his arm out of the sleeve, and I noticed he had cuts. He'd been cutting.
mm,
And I mentioned it to him. I said, "Oh, I see that you have some lacerations there." He says, "I've never told anybody that. I've never mentioned that to anybody." And so, had I not had him in the office and checking his blood pressure, I wouldn't have seen the cuts. He's never exposed that to anyone. So it was kind of nice to be able to get that information.
yeah, and you give him some help by observing that. Because
Absolutely.
sometimes
Absolutely.
patients don't tell you everything.
They don't.
Hmm.
It was kind of nice to be able to have eyes on them and be able to see. Mhm.
And have you hired any staff at Peace?
Yes, I have. I have proudly hired a virtual assistant, and she just started a little over a month ago. And I can't just say, I cannot say enough about how she's done and how she's been and how she has made a great impact on my workflow. So, yes, I have hired a virtual assistant and she's doing well. And she's working for me part time and keeps pushing to go full time. We'll get there. We'll get there. I keep telling her. And sometimes I have to, I see that, she'll answer the Peace phone on a day that she's not working. I have to text her and say, "You do realize that you're off today, right? Why are you answering the phone?" I have also hired a therapist, and she's due to start on the 25th of April. So I have finally hired some folks in Peace, which is great.
Right. And what are like some duties that your virtual assistant does?
Oh, my virtual assistant, she is a powerhouse. She answers the phone. So when I'm working, I'm in office on Mondays, Wednesdays, and Fridays, and I figured that will be the best days to utilize her since I'm in the office doing everything. I'm getting people from the waiting area, I'm weighing people. It would be great to have her assistance then. So I transfer my phone to her phone. So she gets all the phone calls, she handles all the faxes, and she also handles the referrals. So referrals
Okay.
come in, she gets them, she collects insurance information from them, she gets them on schedule. She also verifies their insurance, which is great. She's also will let me know, hey, so and so owes $25. They have a
Mhm.
balance, so she's good with that as well. She also unwillingly, I don't think she realizes that she does this, but some of the patients will actually call and just talk to her for whatever reason, and she's really a nice, kind voice for them. So that's until they can get to me. So that's really good. She does a lot of triage, which I think is great. And she also sends out Zoom links, um, communicates with the insurance companies, and she will also communicate with other providers. She's like a liaison between myself and other providers as well. So she does a great deal, and her role is just continuously evolving.
Mhm. Oh, that sounds like she's a good team player. Awesome.
She lives in Texas, but she's coming to
Mhm.
Illinois next month, and she's requested to work in office. So it'll be kind of fun to see her work in office. So that'll
Okay,
be fun.
cool. Yeah. And see her more.
Yeah, exactly. It'd be great.
And then what type of psychotherapy is your therapist going to offer and when is she going to start?
She starts on the 25th, and
Okay.
she's going to offer, your standard CBT. She is CADC certified, so that she'll be seeing some of those patients that have substance abuse issues. And then one of the things that I like about her is that she also sees children.
Oh,
So
that's good.
she sees
Yeah.
children. So that'll be great. And actually, that's her preferred patient population, but she also sees, adolescents and adults as well. But that's her sweet spot, is the children. I thought that was very important.
Yeah, so
Mhm.
therapist is another way to add revenue to your practice and also for patients to see two providers in one practice, get therapy and medication management. So
Absolutely.
awesome.
Yeah, keep it more collaborative and under one
Mhm.
roof. Kind of nice. It is nice.
Mhm. Mhm. And then my last question are what are the pros and cons of being a psych MP in private practice? And if you had to go back in time, what would you redo?
The pros of being in private practice is you get to set your own rules. You get to
Mhm.
run your own house. You get to determine what the flair is of the practice and how you want it to run, what values, what mission that you want to accomplish and achieve. You can set that up. You practice the way you want to practice.
Mhm.
Um, you accept patients that you want to accept.
Yeah.
And then
Mhm.
you set your hours. That's always nice too. You set your hours. And you practice on your own terms. I absolutely love that. And I'm thriving in my practice because I get a chance to do that. So those are a lot of the pros. Um, and of course, I get to make all the decisions. I make the decisions and it rolls the way that I want it to roll. The cons, peace never turns off. Even though the doors close at 6 o'clock at night, 6:30 at night, sometimes people get squeaked by and it's 7 o'clock at night, but peace never closes. So even on the weekends, I mean, I'm open for every other weekend. I'm open. I see patients for a short amount of time on Saturday mornings from 9 a.m. to 11:30 a.m. I will see patients,
Okay.
but peace doesn't close. So, on
Mhm.
Saturdays, the phone is still ringing. It's
Yeah.
still ringing. People are texting, people are emailing. And so that's one of the cons about it. Just, just it's a 24/7. It's 24/7 and I'm always on call or I'm always responsible. So that's some of the cons about it. But it's a con that is definitely worth dealing with as opposed to going back into an employer situation. I'll do it.
Yeah, it's being an entrepreneur. Being an entrepreneur is definitely rewarding. Like you said, you make your own rules, you make your own hours,
Yes.
and you give more quality care.
Yeah.
Compared to working for an employer and seeing multiple patients a day, and following your employer's policies. Hmm.
Exactly. So I try not to see for my own work-life balance. I'm a single mom, and for my own work-life balance, I try not to see no more than 12 patients a day. 12 to 13 is my cap.
Yeah.
And I'm able to do that. I'm able
Mhm.
to.
That's awesome. And then if you had to go back in time, would you redo anything?
I wouldn't redo anything. I think that I used to think, oh, why did I wait so long? Because I'm an older person now. Why did I wait so long to open up my own practice? I could have done this a long time ago. And I think that the steps that it took for me to get this angry in order to and dissatisfied with the care spaces that I was working in, I think it was a process and I needed to arrive where I'm at. I'm mature and I'm available, and I think that I needed all of those experiences to be able to be successful in my own private practice. So I don't think that I would have changed anything. I think
Anything.
it came about at the right time. Mhm.
And you had the experience before, so.
I had the experience before, so but just getting to this juncture and thinking, you know what, it's time that I do something about this. And I think
Mhm.
that I have the experiences, and I'm grateful to God for that, but the experiences and also the maturity to make this work.
Well, thank you for your knowledge today.
Thank you.
And
Thank you for letting me share.
and thank you for joining us today. Please tell the viewers where Peace is, what city in Illinois?
So Peace is my office is located in Homewood, Illinois. Peace
Mhm.
Psychiatric Services. Mhm.
Okay. So we will add the link to this interview in case you know anyone who needs mental health treatment. Please go to Peace Psychiatric Services. I would highly recommend Asta as a mental health practitioner. And thank you so much for joining us today. Thank you for your knowledge.
Thank you again for having me, Karen. I really appreciate you.
Thank you. Okay.